The National Rural Health Resource Center, or the Center for short, is a nonprofit organization that is dedicated to sustaining and improving health care in rural communities. The center has served several rural communities, hospital, clinics, and other providers nationwide for over 25 years in the following core areas: transition to value and population health, collaboration and partnership, performance improvement, health information technology, and workforce. The Delta Regional Authority, or the DRA for short, and the Health Resources Services Administration's Federal Office of Rural Health Policy, or FORHIP for short, have partnered to support the Delta Regional Community Health Systems Development Program. Through a cooperative agreement with FORHIP, the center administers the program and manages the provision of services to the selected hospitals and communities. Services are provided through technical assistance, which include various assessments, on-site consultations, action planning, and coaching implementation of best practices and adoption of key transition strategies. The center is committed to DEI and anti-racism. We create an environment that reflects the communities we live in and serve, a place where everyone feels accepted and empowered to be their full, authentic selves, and where everyone belongs. We understand the impact of and seek to defeat racism and discrimination in ourselves, our workplace, and the world. This guides how we cultivate leaders, build our programs and resources, and deliver our technical assistance. We are an organization that honors, celebrates, and respects all dimensions of diversity. These principles are essential to our mission and to our impact. To learn more, please go to our website. And now I will hand it over to Jamie.
Good afternoon. I hope you all are doing well today. My name is Jamie Goodpaster. I am the Community Program Specialist for the Delta program at the Center. The purpose of today's meeting is a general overview of the community champion role in building or enhancing community care coordination within your community. So today we will discuss a review of the program goals and community care coordination background. We'll review community care coordination process and the year one timeline throughout the 3-year program. And also the community champion role, responsibilities, job requirements, and experience. So let's start with some introductions. I am going to ask you to share your name and your role at your organization, your location, city, and state, and then what excites you most about having a community champion at your organization. And so be prepared because I'm just going to start calling out some names. So let's start with Amanda Gilbert at Mainline.
Well, my name is Amanda Gilbert. I'm the Chief Project Officer here at Mainline, and I work in Monticello, Arkansas. We, as a whole, Mainline is very excited about the opportunity to have a community champion to get out in the community and to really learn what the community wants. That's what we're excited about.
Thank you, Amanda. And how about who is at Hood Memorial?
Hey, my name is Rachel Artigues. I'm the Quality Management Director here at Hood Memorial Hospital, and we are in Amite, Louisiana. I guess what excites me most about the community champion that we will acquire will be that resource, because we have a lot of ideas that we've never really had an opportunity to put into fruition and to develop a role. So I think it will accomplish a lot of goals that we've kind of been talking about for a while now. So we're very excited.
Thank you. And Gary Sparks.
I'm Gary Sparks, the administrator at Crossridge Community Hospital in Wynne, Arkansas. And we're always excited about anything that will allow us to better serve our community, and whether that's us individually or in collaboration with the other providers in the community. And I also have Joy Shepard, our Director of Community Outreach, on here today. And Joy may want to add to that or not. Thank you.
Let's move to Joy.
I'm Joy Shepard at Crossridge in Wynne, Arkansas. We're in the northeast corner of the state. And I'm the Director of Community Outreach. I've been here for almost 20 years, which is confusing because I'm only 26. But I am looking forward to some new ideas. with community outreach. I think, when you've been somewhere and doing the same type of thing for a very long time, for 18 to 20 years, you're ready for some new ideas. So I'm excited about that position and what new ideas that position can bring.
Great. Thank you, Joy. How about Beth Huff?
Hi, I'm Beth Huff, and I am also in Wynne, Arkansas. I am not directly officially associated with Cross Ridge Community Hospital, but I am very interested in in being that, particularly through this community champion opportunity. I am in my 16th year working in marketing and communications at St. Jude Children's Research Hospital in Memphis, and live here in Wynne. Have family members who work at Cross Ridge Community Hospital. My father was cared for, and other family members have been cared for at Cross Ridge. And I have a strong desire and interest in helping promote the services of Cross Ridge, and just what an incredible resource our hospitals like Cross Ridge and others are for our areas.
Thank you.
And thank you
And
for
how-
allowing me to be here.
Oh, we're excited you're here. How about Trish? We'll move on to the next one. How about Lucy Woodard? Is it Woodard?
Yes, ma'am.
Mhm.
My name is Lucy Woodard, and I'm from Warren, Arkansas. And I'm interested in taking on the role of becoming our community champion for our town. And I'm just excited to see where it takes our community.
Great, thank you. And Christy McDuff?
I am Christy McDuff. I'm the HR director for Mainline. I'm located in the corporate office in Monticello, Arkansas. And I second what Amanda said. Mainline is really excited about having a community champion to be out there and see what our communities need and want from us, and someone to share the mission and the values of Mainline in our communities.
Thank you. And how about Emily?
Can you hear me okay?
Yes.
Okay, so I'm Emily Davis. I am going to be the community champion for Mainline at Monticello. I actually worked for Mainline for about 5.5 years, and then I left to teach, and now I'm coming back for this role. I did referral coordination, and I have a background in social work, so I'm excited to just be able to get out into the community. And I grew up in Monticello, which is where I'm going to be based. So I'm excited to be able to reach out to all those people and just kind of help where I can.
Thank you. And how about Randy?
Yeah, I'm Randy Behrman. I am the administrator at St. Bernard's Five Rivers in Pocahontas, Arkansas, and really just to echo what everyone else has said about the community champion. It's a position we've never been able to afford, and we look forward to having that community outreach in our facility.
Josh Conley?
Good afternoon. I'm Josh Cullen, administrator at Lawrence Memorial Hospital in Walnut Ridge, and everyone's already said most of what we're looking forward to, but really getting someone in our community and educating on the good work we do here at the hospital, also getting out there and helping attack social determinants of health and be a champion of our community.
Great. And I see there's someone else in Bradley County. I know Brooke is on. I was going to get to her next, but I see a Bradley County without a name.
That would be me, Marilyn Johnson. I'm Chief Administrative Officer here at Bradley County Medical Center in Warren, Arkansas, and we're excited about this position because it's extra boots on the ground to spread positivity, the good things that we have going on, and also be an ear to the needs of the community and help be a part of the discussion about how to meet those needs.
Great. Thank you. Courtney.
Hey guys, my name is Courtney Crawford, and I'm the Community Relations Director at Lawrence Healthcare in Walnut Ridge, Arkansas. I'm really excited about bringing a community champion in just to get the blind spots out as far as the health of the community and just make Lawrence County a overall healthier place to live.
Thank you, Courtney. We're excited you're here. And Teresa.
Good afternoon, everyone. This is Teresa Grimes. I'm the hospital and a nursing home administrator in Washington County, which is Chatham, Alabama. I have with me Taylor Elmore. She's our HR director. What excites us most about the community champion is a goal of ours has been trying to bring the organizations together in our community. It's very fragmented, so we're hoping to become the hub and feel like this community champion can help bring the resources together, probably a lot of duplication. So to be able to figure out what everybody offers and doesn't offer, and to really work to mesh the healthcare, as well as, of course, as everyone has said, getting out in the community, letting them learn more about what we do, learn more about what the community could offer. So we have high hopes for this community champion and lots of expectations for them.
Thank you. Brooke Hatch.
So I apologize. My camera is offline. I've been making new employee badges today. But I'm HR at Bradley County Medical Center. And like Marilyn said earlier, I'm just excited to have someone focused on these needs and this outreach. In a small hospital, you have a lot of people wearing a lot of hats. And so to be able to have someone just worrying about or just focusing on the community aspect of it would be great.
Candy Kelly. How about Sarah Lothar?
I'll speak for both of those ladies. I don't think their microphones are working. They're with Five Rivers here at Pocahontas, Arkansas.
Thank you. Joni Bishop. And I think these people don't have microphones. That's where we're having issues there. Okay, well then let's move on. If you would, so let's talk about program goals here as we get started. Oh, yes.
Stephanie Moffitt, HR Director at Ouachita County Medical Center in Camden. Glad to be aboard this meeting. I also have with me a potential community champion, and her name is Miss Sharice Allen, and sitting in on the call. And we are just excited about this position, echoing everything that everyone has said. We know that healthcare has suffered so many things these past couple of years, and haven't had the opportunity to have this position. So we are just thrilled to be able to get someone out into the community speaking a voice for healthcare. Ms. Sharice?
Everyone has actually said everything, but I'm just so excited about being able to empower the community and the hospital coming together. I think someone also said earlier about being able to just totally focus on that and bring the organizations together, because here in Camden, a lot of times different people do different things in different organizations, but yet they don't know that they do that. They're not aware of they have these different resources. So I'm really looking forward to getting out there and showing and giving the community what they need, and also the hospital, working with the great people here at the hospital so that we can all just be one great, awesome community.
We're excited to have you here. Is there anybody else that I missed by chance that has a microphone that I've missed, hasn't been able to introduce themselves?
Hello, my name is.
Let's start. All right, let's start with, it says Ariel, or is it Ariel?
It's Ariel.
Okay. Thank Ariel. I want to make sure I'm saying that right.
Hello, I am the HR Director here at Lawrence Memorial Hospital. We're located in Walnut Ridge, Arkansas. And what else am I missing? Oh, what excites me about having a community champion? I'm excited about another position, another person being able to educate the public on the services that we provide and helping us improve upon those services and going back out to the community. So, thank you.
Great, thank you. And then we have one more person who dialed in who hasn't been able to introduce themselves.
Hi, this is Penny Welch. I'm the Human Resources Director at Oakdale Community Hospital. We're in Oakdale, Louisiana. We are super excited about this program and having this community outreach person because the community is very important to us. It's our middle name. And we're going to have this person work very closely with our marketing coordinator so that we can increase the public's knowledge of what all services we have to offer at our hospital.
Great. We're excited you're here as well. Okay, I think now that I've got everybody, we'll move forward to the program goals. So working with inspired leadership, developing innovative and collaborative efforts, and having access to forward-thinking technical assistance, the DRCHSD program, which is also referred to as the Delta program, helps rural healthcare organizations continue to deliver care in the face of overwhelming adversity. So there are three main goals of the program: implement best practices to increase financial performance, operational efficiencies, and improve quality of transitions of care; to build partnerships. This helps increase telehealth utilization, ensure access to emergency medical services, and address workforce recruitment and retention needs; and collaborate for sustainability by integrating social services, develop a community coordination of care plan, and strengthen the local healthcare delivery system. Now, to the CEOs here, please note that you will be actively engaged in meeting all of these program goals, as the program is comprehensive and not a la carte. But for today, we're going to focus on that third program goal, collaborating for sustainability. So the DRCHSD program refers to Stratus Health's definition of community care coordination as a partnership among healthcare professionals, clinics, hospitals, specialists, pharmacists, mental health professionals, community services, and other resources working together to provide patient-centered coordinated care. And the purpose of community care coordination, or CCC, as we will refer to it occasionally throughout the program, is the same, whether you are coordinated with a clinic, hospital, or through an ACO or patient-centered medical home. Community care coordination planning process is designed as a stepwise approach over 3 years to improve transitions of care. Each step includes 1 to 2 community events or workshops, which are facilitated by the center's program specialists with your champion. Step 1 builds and fosters collaborative partnerships between local providers and agencies for the planning and development of your organization's community care coordination plan. Step 2 identifies community priorities for action planning that improve care coordination and transitions of care. And Step 3 assesses program progress, reexamines priorities, and updates action plans to support ongoing development and sustainability of a local continuum of care. So the Delta program provides funding for Community Champion to assist in the team with meeting the Delta program's purpose of making in-depth system enhancements to position the organization and community for population health and achieving the DRCHSD program goals. The center supports the selected organizations by providing personal documents to guide the champion hiring process. And throughout the program year, center staff will work one-on-one with the champion to build their capacity in supporting their hospital towards sustainability. Community champions are essential to the hospital and the clinic's long-term success in preparing for population health and play a critical role in the program. Champions are expected to plan, implement, and complete activities to support the CCC process. So community champions come from a variety of backgrounds. This slide shows backgrounds of our previous champions. And as you can see, they vary from clinical to education, ministry, and marketing, just to name a few. Most importantly, they should be motivated and capable of self-directed work. Friendly and outgoing. They need to be someone who's comfortable with conducting outreach within the community, facilitating group discussions, and giving presentations, and have a strong desire to help the community. For the next few slides, we're going to cover some of the more technical skills and roles and responsibilities of the community champion. So this slide here, we're going to first talk about communications. So as a liaison between the healthcare organization, the community, and the center, a large part of the community champion role will involve effective and ongoing communications to facilitate the community care coordination planning process. This also includes building relationships and rapport with community joint partners. Planning. A few slides back, we showed you the community care coordination map where we mentioned the champion will be the primary facilitator of the community care coordination planning process. Examples of planning involve coordinating and facilitating community meetings and events, including but not limited to things like venue identification, sending out invitations to joint partners and confirming their attendance, developing presentations for the events, and collaborating with the center to provide updates to support the planning of workshops. And much more than that. That's just a piece. They will also schedule follow-up meetings with community joint partners and healthcare organization leadership teams to determine progress of CCC action plan implementation. Community engagement. Champions are as boots on the ground, as was mentioned earlier by one of you all. And they support the community's perception of the healthcare organization. And as such, they will conduct community outreach to local health and social service providers. They'll build community support and gain buy-in for program activities. They'll also act as a catalyst for culture change regarding community care coordination. They'll promote health and wellness by building awareness of locally available resources and promote the healthcare organization's services and quality of care. On occasion, and as it is related to their role, champions will assist with other program goals, for example, telehealth or FOA, QI consultations and assessments. The center will work to help build the capacity of the champion to be successful in their role. This is obtained through our learning collaboratives, one-on-one coaching, in-person and virtual boot camps. We have the summit and other ad hoc capacity building activities that will be in person, and all of which are required for the champion. In their first year, champions can expect to receive onboarding learning, participate in one-on-one center calls, and attend a virtual boot camp. And they'll also participate in our in-person summit, as I mentioned before. So let's take a moment and chat a little bit about this role and what are some of the questions that you have or clarifications that you might want about the position itself. Is there anything that intrigues you about the position? What especially, intrigues you regarding this role and how it might impact your community? Feel free to just jump in.
I do have a question.
Sure.
My concern is it's a 3-year position. What happens if we hire somebody and after a year they find another job?
Then we hire a new one. I think that we've had a couple of that happen a couple of times in the past where there's been champion replacements for various reasons. I think Selena might be able to talk to her experience with that.
Yeah, that's a great question, and it's also valid and realistic. We have had that happen in the past, champion turnover, but we are strong in our processes, and we will work one-on-one with that replacement champion to bring them up to speed in their role. And much like what we're doing right now in helping you to identify candidates, we could also schedule some one-on-one time with you to say, okay, what happened with the previous champion? What are some lessons learned even? And let's help you to identify another candidate. So it happens, but it doesn't happen too often. I would say that having ongoing communication with the selected champion is going to be critical. You want them to feel as though that they are a part of the team. A lot of our champions are contracted employees, and so that could be different if they're brought on and they don't feel that inclusion. So that is critical in keeping the engagement between the champion and the leadership team and that support of their supervisor to make sure that they have the time dedicated to fulfill the roles and responsibilities. But on average, we don't have high champion turnover. Thank you for that question. This is your time, guys, so please ask away.
Yes, please. Any other questions? Oh, go ahead.
Selena, you mentioned lessons learned. Are there some lessons learned that you could share with us, or is there a place where some of that is listed?
We don't have a place that lessons learned are listed, but one, as I mentioned, engaging with your community champion. So when we started this program, of course, we've learned a lot from you guys. And since then, we've created this connection form. So when a champion is onboarded, we have the supervisor and champion complete a connection form. For us, it helps to promote that cue of making sure you guys are intentionally meeting with the champion on a weekly basis. Some other lessons learned, I would say, is just to make sure you're not hiring a champion that's also connected to direct patient care. We've had that happen in the past, and champions were overwhelmed with trying to handle those dual roles and responsibilities, especially when the pandemic hit. Of course, it was all hands on deck, right? And so we had a champion that was also centered around patient care responsibilities. It was really tough to have them focus on the community care coordination planning process. So those are the two biggest ones that I will mention as far as like lessons learned.
For the community champions, is there a requirement or a need to have office space within the hospital, or how does that roll typically?
So we have a champion letter of agreement that all the CEOs have received and signed. And in that letter of agreement, it does outline that the organization is responsible for providing a workstation for that champion.
I think that throughout all of the lessons learned, we've tweaked our processes with that. So we've a lot of what you've gotten from us comes from us learning lessons over the course of this program. So they are always changing as we see fit. So that's really important piece too. There's also a question in the chat about what materials, workspace, or supplies are needed for the position. So as Selena just mentioned, that you do need to supply a workspace for them. They are going to need to have a computer with a camera and the ability to get online and participate in these online learning collaboratives that we provide. We do really encourage folks getting on their camera, and so we can see their faces and kind of get to know them ahead of time. I mean, we will visit all of you at some point, but this is kind of how we connect through our distance. So that's the really important piece. And then supplies, general office supplies, I would think. Anything else, Selena?
I think you covered the bulk, the more priority items. Let me touch on like funding for events, right? Because we've had that question. A champion getting ready to host a Connect event, they would ask, do I need to purchase food for this type of event? Do I need to go out and buy special invitations to encourage participation? That is not something that we require of our healthcare organizations. We do realize that your funding is limited to what is within that budget. So we work with our champions to say, hey, tap into your local grocery store. I'm sure that they would be excited to donate some type of food for these particular events. That oftentimes come up, and I don't know if that's supplies as you guys are thinking about it, but it's not a requirement that the champion is paying for food, paying for invitations. Most of our invitations are electronic. I mean, it's something as simple as sending an email. But of course, we know in the Delta region, and I'm from the Delta region, I live in Mobile, Alabama, so I can speak to this. We do like more of the personal touch. So of course, printing invitations from the hospital is encouraged to just add that additional touch to invite those partners.
I know that we
have
have
any supplies in particular that you're wondering about that I can clarify for you? Okay, go ahead, Jamie.
I'm not seeing anything in the chats. I'm watching here. I know that some of you have, made steps to identify potential community champions or hired community champions. If anybody has done that, I'd love for you to speak to how your organization has approached that and how that process has gone for you.
Hey, I have a question.
Hey, Emily.
Hey, so I will be taking on this role for community champion. So I'm curious to know, like, with the trainings and the webinars and the boot camps and stuff, will we be able to like talk to other champions who have been doing this? Like, that's what I'm curious to kind of pick their brain and kind of get a feel for like what to expect. You know what I'm saying? Like, will we be able to meet others, or how does that work?
Yes. So we will have other community champions in some of our learning collaboratives talking about their experience, sharing, and even doing some facilitating based on what they've learned over the time that they've been in this program. We do these in sort of cohorts, right? So the folks from last year and, they will be at the boot camp summits, things like that. So you'll get to meet them then too.
And Jamie, I'd just like to add to that, we do make it an effort to bring you guys together because you are more of the boots on the ground. You do learn from each other. So peer-to-peer sharing is important to us. Weekly, we have champion Q&As, and those are on Tuesdays and Thursdays. It's more like office hours. So if you're able to drop in, come in, ask whatever questions that you may have, or even chat with another champion. So just kind of see what they're doing as you're all working together to help improve the health outcomes of your communities. So that's one thing. Once we onboard this cohort of champions, shortly after the second learning collaborative, we will host a champion meet and greet. And so that's where all the champions that are currently a part of the program will get a chance to meet, greet, ask whatever questions that you may have, and hear from your peers. So yes, that is very important to us. And we share champion contact information too at some point during that onboarding.
Are any other questions or experiences anyone would like to share? This is our time with you to answer all of them as much as we can anyways.
This is Teresa from Washington County, Chatham, Alabama. We have had this position posted for several weeks now. We've only had one applicant, so I'm interested in hearing from the others as to success factors. We have listed as a part-time, so Taylor and I have talked about the potential that it listed as a full-time position in order to get other applicants. We've not interviewed the one applicant yet, but we were hoping to get more applicants that met the qualifications. So any help or thoughts or anything on that line would be helpful. Thank you.
Any other organizations want to share their experience? We would love to hear that first. We do have a condensed job posting that might be helpful. So I can connect with you and get something like that to you. And that might make it a little bit more appealing for being a part-time position. So we can connect later and kind of go over what you're, kind of troubleshoot a little bit. But I would love to hear from any of the other organizations here who've been successful in hiring, how that went for them.
This is Joy Shepherd from Crossridge. I'll just say that we haven't posted the job publicly. We weren't sure if we had to or not, but we haven't. To me, this is such a specialized position that I think it's important to find the right fit, and to really look around your community and look for that person that you think would be a great fit. I think that's a good starting point if you haven't done that yet, or ask around and, find the right people. To me, there's always people who are out there that maybe no one thought of. And the more people I ask, listen, somebody who might be interested in this? When you live in a small town, it's amazing what kind of feedback you get from other people, and just really actively recruiting yourself for that position. It's very specialized, and it really has to be the right person, I think, to be a success. So that's an important way to do that.
We actually are trying that. We have our physicians, our board members, our employees, all engaged in trying to hopefully find the right person for this position, because we all realize it is a critical position and we're excited about it. So.
Oh, we
I'm
were
gonna-
extremely
go ahead.
lucky. Oh, go ahead. If
No,
somebody
you go
else-
ahead, please, please.
We were extremely lucky because Emily, you know, like she said, that she'd worked for Mainline for years before, and then she went back and wanted to be a teacher, and then realized that that wasn't for her. But she was an outstanding employee. She knows our company inside and out, and she's very outgoing. So it's kind of like a win-win. We really lucked up with that one. So we don't have to, that's what we were worried about with a community champion, because we don't want an outsider that knows nothing about us, because then they don't know what we offer and they don't know who we are. And Emily has that history. So it really did work out. We feel very, I don't know, we're very happy about it. And we're excited.
Awesome. And I do think that, you know, having someone from your community, like we've said, is very important, right? That they know the community and they have a passion to help your community specifically. And, you know, so once you get that, then you can kind of, you know, the other transferable skills that someone might have. And I think it is important to network and reach out to different folks around town, because somebody might not think they're looking for a job, but you might have the perfect one for them. So I do also go ahead.
Oh, I just want to jump in here, Jamie. We've had unique situations. So one of our champions, she was actually a patient of the healthcare organization. And she just talked about how the healthcare organization just did so well in providing quality of care to her family. And she wanted to volunteer at any point in time she could. And so this champion position came along, and it was just like the perfect fit. So you may have to just kind of think outside the box. Think about if there is a committed volunteer at the hospital. If you have a patient family advisory council, there may be somebody within that council or committee that would be a perfect fit for the champion role. If you're wanting to intentionally partner with an organization, let's just say faith-based organizations, reach out to them and express, hey, we have this position available. We want to make sure that we are keeping it in the community. Is there someone that you would recommend for this position that we could interview? So I wouldn't say stop at the post, you know, not just posting it, but actually get out there and explore those different groups that you would like to intentionally connect with. And maybe they have someone that is already doing similar work, and that would be a good fit for the champion role.
Most of these people that are interested do not meet the qualifications that are required in this job position.
Okay. And so, Teresa, can you just speak to some of the things that they don't meet, I guess, or can you just kind of speak to their qualifications?
Is it a bachelor's degree, or either 3 or 4 years? I don't have it in front of me. The years of experience in healthcare are either the educational requirements.
Okay. And so we are expanding, you know, our process around, like we mentioned, DEI. So we want to be inclusive, even if they don't have a bachelor's degree, that's okay. We have had potential champions as far as like recent graduating students from high school that are interested in the position, that are committed to being with the community long term. So don't feel as though you have to stop there at the bachelor's degree. We also provide a lot of training to help bring them up to that skill level that's needed to fulfill the role. Jamie highlighted some of those soft skills that are critical, and that's what we really would like in a champion. As long as if they are self-motivated, they're a self-starter, they are passionate about the community, they have some general knowledge about health and health outcomes, they're involved in the community. Just think about some of those things, and I'm just not encouraging Teresa, but other folks here that are participating in those situations, reach out to us and say, I'm not sure about this person. Is this a potential? Could we work with this champion to bring them up to speed to be successful in the role? And we can kind of help you evaluate that.
And I like to look at it as sort of like, what is adjacent? What kind of work have they done that's adjacent? So maybe they didn't work in healthcare, but maybe they collaborated with healthcare partners in the past, or they have, volunteered in healthcare a little bit, and their work, they have shared partnerships or shared committees or anything like that, where they have some level of knowledge of how things work, but they're more, they have a lot of those other skills. That's a good way to kind of look at it as well. Also want to jump. Go ahead.
Because I'm so sorry. This is Sharice. I'm kind of glad Teresa brought that question up because, okay, I forgot who was just talking just then, but what about if they have not had any of the adjacent skills as far as working with the medical, but they're really good with soft skills, also really good people skills and with the community, and know the community quite well, and are very known out there. But at the same time, when it comes to, let's just say, technical skills, like PowerPoint and different things like that, exactly how much training is available when you need those kind of things to get out there in the community, or to just make presentations, different things like that. I mean, this person, I believe that I'm very comfortable once you know the actual content that you're putting out there. However, the way to put it out there, whether it's through meetings or putting meetings together or PowerPoint, is there training for that kind of thing?
So we provide a lot of facilitation training, and we do provide supports. So we will go through PowerPoint with someone. So, it's important that they have the basics. We do like a PowerPoint 101 a little bit, but they need to at least be able to, have some general sort of Microsoft basics. I found that if they don't have that, then we end up, it takes a lot longer. And I think the organization is going to have to be a little bit more patient and provide a little bit more supervision over those types of things. Selena, is that any other comments on something like that?
Yeah, I think you hit it spot on. A bulk of what we do is providing facilitation training. And that includes how to even create an agenda, how to facilitate a meeting to where everybody feels like they are engaged in the meeting and that there's not one voice just overpowering the conversation. So the training is here. And I agree with Jamie as far as just having that basic general knowledge is key.
Okay, thank you.
Thank you.
I also want to share real quick, just a question from the chat about the champion being hired on full-time role, splitting 20 hours as a community champion and 20 hours for marketing. And Selena answered this question, but I just want to share it all with you. So this is we need to remember that the champion needs to stay at 24 hours, and then any additional hours, if you want to make this a full-time role, that extra 16 could be picked up in marketing or, something else within your organization. But we, as Selena also mentioned previously, we recommend that that's not direct patient care.
Yeah, we have several champions that do have dual roles. And just to speak a little bit more about that 24 hours a week, that does ebb and flow. Sometimes it's less than 24 hours a week, and sometimes it's more than 24 hours a week. It really depends on where you guys are in the program and in the planning process. So it ebbs and flows.
Do we have any more questions we can help you with? Before we move on to some next items here.
I just want to, excuse me, what else can we do to support you guys in the hiring process?
But maybe they feel supported, Selena. I don't know.
I hope so.
I think that we have, I have a lot of resources, so I can't think of anything additional at this point that I would need.
Great, great. So I'm going to go ahead and start sharing with you all again here. All right, so let's talk about next steps. So you will submit your first champion invoice by April 14th. This is required if a champion has or has not been hired. We'll go over those here in the next slide a little bit too as well and answer some of those questions about those because I'm sure we might have a few. Hiring and onboarding needs to happen by May 15th. And as we've mentioned, we are available to assist you in the hiring process and review applicants and help with the interviews, anything like that. And also, help troubleshoot some of your recruiting issues. We are here for you for that. And then Community Champion Onboarding Kickoff Learning Collaborative is on May 31st at 9 a.m. This is a virtual event, and this event is required for champions and supervisors to attend. So as I had mentioned about the invoices, so just a quick recap. This is an example of what a champion invoice should look like, and you should have received your sample in an Outlook invitation. So quarterly invoice is due on April 14th. This invoice will be a description of any services performed to identify and or onboard your community champion between January 1st and March 31st. Invoices must be completed and submitted to invoices@ruralcenter.org by the accounting or your finance department. Are there any questions we can answer around the invoicing piece? I thought we would have quite a few questions about that.
I was waiting on a few, but just to highlight one thing, we're not asking that you itemize your invoices. It's the invoice is the quarterly amount that's for the champion position. So we don't ask that it be itemized. We look for more of the description through that services provided. So we do expect to see, what has been taking place to justify reimbursement of the champion invoice.
And lastly, we will send you these slides and the recording of this so that you'll have it. But this is our contact information for the CCC program staff at the center. These are all of our community program specialists, Selena, our subject matter experts, and our program coordinators. And also here is our general contact information, and you all will get this after today's event. And we hope that you we were able to help you and that this was helpful for you. Again, if you have any questions, please reach out. We are here for you. That's our job. So is there any other questions or comments before we head out for the day? I might give you a few minutes back.
I have one. How long is the training on the 31st?
It is, I don't have to pull up. Is it two? It's a couple hours. 1 second. Then
And what is it
hour and a
called
half.
again?
An hour and a half.
Okay.
From 9 a.m. to 10:30. I think Becca has sent out invitations to all of the CEOs or supervisors. So if there's anybody you want us to add to those mailing lists that you have recently hired, please let us know. Or you can forward that to people too. So
The May 31st meeting, that would be in person, I'm sorry. And what is the title of it again?
it is our onboarding kickoff learning collaborative. mix those words up, but I think we call it the Onboarding Learning Collaborative. And it is virtual. It will be via Zoom at 9 a.m. Central Time. And so it'll just be like today, we'll log in, and that's for the CEOs and champions.
And we will be releasing that. I'm sorry, you probably don't see it on your calendar. So we will be releasing that calendar date in the next week.
Okay.
And as you hire your champions, as you're letting us know that they're hired, we will continue to submit or forward invitations.
I hope this was helpful today, and it was great to see your faces and get to know some of these new champions or potential champions. So I'm excited to work with you all. Again, if you need anything, please reach out, and I appreciate you all coming today.